Welcome back. President Cyril Ramaphosa signed the Presidential Health Compact on Thursday, calling it a turning point for the healthcare sector. Mr. Ramaphosa said the signing of the Health Compact was the conclusion of a long journey that began at last year's Presidential Health Summit. Key stakeholders were brought together at the 2018 summit to design a roadmap for South Africa's path to universal health care with the National Health Insurance as the entry point. Ramaphosa said the compact's goal was one country, one health system. For more reaction to this, we are joined by Charlton Murove, who is head of the research department at the Board of Healthcare Funders. Welcome to our program.
Thank you so much for having me.
You've been at the conference and observing various input from several stakeholders who took part. What has been your impression regarding the inputs that have been made on the road map towards achieving a composite or rather comprehensive healthcare system?
Okay, thank you for the question. So the conference was quite interesting. The theme of the conference was Convergence 2030, Healthcare Reimagined. And I think in South Africa it was a very appropriate topic for the conference because our health system is currently characterized by so much fragmentation, and a fragmented health system doesn't help much. Hence you see the president calling for the health summit, trying to bring lots of stakeholders together so that we can start looking at our health system and propose solutions to it together with everyone participating in that process. So the discussions at the conference were quite pointed, and we're looking at how we can get all stakeholders working together, whether you're from government, and we no longer call it private, but we call it non-state actors, so that we can contribute to building a better health system for South Africa.
But then how is it going to be achieved when you look at the bottom of the chain being crowded with many people who are poor, unemployed, and cannot afford primary health care, vis-a-vis government's inability to provide quality health care in terms of lack of resources and, of course, shortage of doctors? And you know that in South Africa, the issues that have been hogging the headlines were related to security at hospitals and so forth. How will that be achieved?
So I think it's a long journey. I think I want to expect that the problems will be solved at one go. But the problems that you highlight are the exact reasons why we should intervene. At the other side of the table, in private, you have so much excess capacity. I think there are virtually no waiting queues, and you actually have more resources in terms of healthcare manpower. We don't have a shortage of hospital bed. Our bed occupancy is quite low, whereas with the public side, it's quite the opposite. So when we are able to come together and start looking at ways of fixing the healthcare system, you can have a redistribution of resources. And I think that is what NHI is trying to achieve. And we hope we working together will actually get there.
Has there been any comparative analysis in terms of healthcare models of other countries where you find that the state is providing 95% of subsidization, whereas the private healthcare sector is contributing minimally?
Yes. So healthcare systems are very different, and what we have noticed is you cannot have a model working in one country transported to another and hope that it works. One of the presenters at the conference was actually from the World Bank, and he gave a wide overview of how health systems are characterized and how they are transitioning towards universal healthcare coverage. So what they have seen in Africa is it's virtually impossible for governments to try and do it alone without private sector involvement. So their organization helps in terms of trying to bridge the gap between public and private participants in healthcare.
What are the concerns of the private participants? Are they not really wary of the fact that their value contribution will be diminished if there's a merger of the two economies, that is the poor and the rich?
Yeah. So I think we can summarize it primarily by just using the word trust deficit. No one really trusts the other. I think people in maybe government, when they look at private, they become a little bit weary, interested in profit, profit-driven and not really interested in the health of the citizens. And then when you look at private participants, NHI, does it threaten us? Does it mean we will be able to have the same access we currently have? And then when you look at how the public system is failing, people start thinking, so that is what we'll have to go and endure when we need healthcare. So I think it's a bit of trust deficit and also uncertainties around the future. So I think because there are those problems and uncertainties, people become too scared to move to something that they do not know.
So as we wrap, what's going to happen to public clinics and hospitals, and what about private hospitals if we are saying NHI is in place?
So I think, I don't think there will be any healthcare resource that will sit idle. I think all healthcare resources will actually be used when we have universal healthcare coverage with NHI in place. I foresee a situation where government actually goes and even contract with other private players. So for me, the ideal situation is we start using all our resources as efficiently as possible, never mind where they are or who owns them. So for me, that should be what we should work at.
All right. Thank you very much for making time to speak to us.
Thank you.
Right. That's Charlton Murove, who is head of research at the Board of Healthcare Funders. And of course, we're going to take a break. And after this, the program continues.